Good morning, friends. First of all, I would like to wish you a safe and healthy quarantine and would humbly request all of you to stay at home and stay safe in these trying times. On this note, I would like to introduce myself. I am Dr. Kailash Patil, knee specialist, joint replacement, and sports injury surgeon at the prestigious Sancheti Hospital in Pune. Friends, we are facing a grave event in the form of the corona pandemic, and I'm sure everyone is taking care of themselves as well as their families. However, we tend to overlook a lot of problems which we face in our daily lives, and those are the knee and the spine problems as well as hip problems. So, I would like to enlighten a few things about this in today's talk on knee and arthritis problems faced by all of us during these times. However, I would also like to point a few pointers about coronavirus and its effects. So basically, coronavirus is a COVID-19 virus, and it is called 19 because it was discovered in December 19 in the Wuhan province of China. It has basically a crown-like structure, and hence its name has been hence it's named as coronavirus, and it basically affects your respiratory system and it causes a lung fibrosis at the end stage. It shows basically flu-like symptoms which include fever, a runny nose, cough at times, loss of appetite, loss of sense of smell, body ache, myalgia, as well as diarrhea and lung issues, as well as pneumonia. So, friends, can it be prevented? Yes, it can be prevented. It can be protected also with a lot of things which have been told to all of us, like social distancing, like hand hygiene, and all these issues, because it causes transmission from surface to surface and remains on any surface for about 8 to 10 hours. So, friends, during this time, I have received a lot of queries regarding arthritis, knee problems, hip problems, spine issues. So, I would just like to touch upon a few points on arthritis and its issues. So, once Rajneesh was asked, "What is the greatest adventure in evolution?" and he very aptly answered, "That is, the greatest adventure was when one monkey decided to walk on two legs, and that was the start of our issues with the knee and arthritic issues." So, arthritis is a problem since a long time. It has been present since dinosaurs, it is present since mummies, when Ayurveda was invented, Shushruta was there, Charaka Shastra was there, and traditional therapies also. So, basically, it's a degenerative disease. It is age related and occurs in load bearing joints like the knee. So there are two types of arthritis, friends. One is osteoarthritis, which is caused by the cartilage damage due to wear and tear of the joints. And the second is rheumatoid arthritis, which is because of the cartilage damage because of the involvement of the synovial tissue. So what are the risk factors involved in arthritic joints, or rather osteoarthritis? It is basically increased age, sex, repetitive use, that is heavy sports, obesity, squatting on the grounds, and genetic factors, as well as at times smoking also. So does it occur with age? Yes, arthritis can start as late as 40s, 50s, or 60s, and it is not very common before the age of 40. There are a few questions which a lot of patients ask, whether it is more common in women. Yes, in Asian population, for especially the knees, it is more common and more severe in knees because of obesity, decreased activity, and osteoporosis. Also, does it cause because of injury? Yes, it does cause because of injuries, because in younger age we tend to neglect a lot of injuries like meniscus injuries, ligament injuries, as well as cartilage injuries. Obesity, one of the major causes of causing arthritis or knee pain, and that is usually in the age group which is more than 40 years and a BMI of 30 years. Squatting is most common in Asian population, or rather more in Indian, Bangladeshi, Pakistani, Sri Lankan population, and it is our day-to-day activities. We use a lot of squatting and sitting on the floor with cross-legged, and that predisposes to osteoarthritis or knee pain. Is it hereditary? One of the reasons of causing osteoarthritis is hereditary. That is, if your parents are having arthritis, there are more likely chances that you get it, and you may get it at an early age. Other effects such as addictions, such as smoking, alcohol, it does cause smoking. Yes, it has proven to cause a lot of cartilage damage and knee pain. So, what are the symptoms? How do we know that we have arthritis? So, there is pain, swelling, deformity or bowed legs, restriction of movements, and instability. There are treatment options available, and there are two types of treatment. One is that is preventive, which I'll discuss at a later point, and other modalities are non-operative and operative. So in non-operative treatment, what we can do is you can use drugs, we can use certain systems such as bypassing the joint load, using of orthosis or equipment which uses like a kneecap or a knee brace, injections. Most importantly, what we can do is exercises, cycling, hydrotherapy, physical and occupational therapy, heat and cold applications depending upon the stage of or severity of the disease. Drugs, yes. Local application creams, over the counter medications like crocin or combiflam to take care of the pain, cartilage developing drugs or biologic agents which are glucosamine, chondroitin or diacerin, which are also available over the counter, or else prescription painkillers such as paracetamol, diclofenac like Voveron, ibuprofen, Brufen. These should be taken only on prescription of a doctor or in cases of severity of the disease. How do you bypass the joint load? This can be done in variety of ways like decreasing weight by dieting and exercises, pace your activities through the day, wear shoes with thick and soft soles, use walking sticks. Orthosis, there are different type of orthosis. Orthosis are basically external equipment which is used to offload the joint. So these are like external knee supports to reduce the load on the inner side, that is the most commonly affected side of your knee, give relief in early arthritis. But most of the times the compliance in such cases or use of these orthoses is very limited, and patients tend to not use these orthoses. But in these times we should use them. Are there any other modalities which can be used, such as Ayurveda, naturopathy, homeopathy, acupuncture? Yes, definitely. Anything which causes or which relieves a patient of any kind of pain or discomfort, you can definitely try that kind of treatment. So if all the modalities do not work, then what is the option? And the option is a knee replacement or a joint replacement surgery. And yes, is this now a lot of patients who come to me, they ask me, doctor, now this lockdown is going on, are you doing surgeries, are these kind of surgeries happening, or what are the effects of these surgeries in these times? So what I would like to mention here, friends, is these surgeries are planned or elective surgeries. These happen only after a lot of workup, and these happen only after when we have decided to get it done. So in these times, what I would request you, friends, is we will limit these kind of surgeries unless until it is an emergency like a hip fracture or a spine fracture, and we will do these kind of surgeries when the appropriate time comes, and we will do it as properly as needed and as required. So can you avoid it at this time? Yes, definitely you can avoid these problems. So as I told you earlier, I was coming to the preventive portion of these kind of issues. And what we always know is prevention is better than cure. What it requires is healthy diet, weight reduction, and exercise. So achieving physical fitness by balanced diet is very important. What you need to know is your diet should contain all of the contents like proteins, which should be about 10 to 15%, carbohydrates, which should be about 55 to 65%, and fats, which should be about 15 to 30%. And this should not be limited to a few months, but it should be continued overall. So nutrition is very important. What it requires is quantitative reduction, as it is important as the quality of diet. The risk of osteoporosis and fractures, they can be reduced with vitamin D and calcium supplements. Also, the most important point in knee pain or arthritic pain is avoiding obesity. It is definitely associated with arthritis, diabetes, hyperlipidemia, and loss of your daily height. The holistic approach, along with the body, treat your mind and your soul and generate a lot of energy. So you can try nutrition, purity of mind, that is reduction of stress, and pranayam also. Physique you can improve by hatha yoga, surya namaskar, physiotherapy exercises, as well as aerobic exercises. So you can achieve physical fitness by regular exercise, and exercise which contains any body activity which enhances or maintains the physical fitness and overall health. Exercise started at the age of 30 to 39 results in 5 years of healthy body and mind. So What are the contents of these exercises? That is aerobic exercises, muscle endurance and strength exercises, and range of motion or flexibility exercises. Aerobic exercises basically are brisk physical activities which requires that the heart and the lungs work harder to meet the body's oxygen demand, and it promotes the circulation of oxygen. Also, spend half an hour each day in physical activity like brisk walking, swimming, and cycling. Nowadays, it is not possible to do brisk walking and swimming. So, what you can do is, if you have an enclosed house, or rather a big house, you can do a pradakshina kind of thing, or go around the house. If you're staying in a flat or an apartment, what you can do is go from one room to the other and go back again, and this way you can increase your walking activity, and this leads to your aerobic exercises. These also use to reduce weight and decrease the risk of any other issues. Muscle strengthening is most of the muscle loss with age is secondary to inactivity. So in order to reduce this, it is also called as sarcopenia. So in order to reduce this, you should always do muscle strengthening exercises like dumbbell exercises, weight exercises, and it reduces fatigue and body aches in your body. Range of motion exercises, so this will help in increasing the flexibility of your body. So as your age advances, what happens is your body tends to become stiff and it tends to become a little lazy, and these exercises help to maintain the optimum function of the joints. So benefits of regular exercise are: it increases your health status, quality of life and expectancy, maintains and improves cardiac function. Also, it increases postural stability, decreases the risk of falling, preserves your cognitive function, and alleviates depression and symptoms. So, what is the difference between exercise, exertion, and exhaustion? So, a lot of women nowadays do a lot of household activities, as well as we are seeing a lot of videos which come upon where the men are doing washing utensils, cleaning up the house, sweeping up the floors. So, these are more of exertional exercises or exhaustive exercises. So, what exercise usually does is it increases the pulse rate and respiratory rate by 20%. In exertion, what we do is we accumulate a lot of lactic acid in the body, and in exhaustion, that is causes a lot of extreme mental and physical fatigue and results in too much of exertion. So working at home is not exactly an exercise, but we should have a scientific approach to these exercises. In order to see these exercises, if you are not aware of the physical therapy or the physiotherapy exercises, you can definitely visit our website, that is the www.sanchetihospital.org, or you can visit our Facebook page where we have given a lot of exercises which are helpful for your spine as well as knee issues. Also, I would like to, friends, mention a little bit more on mental and emotional fitness. Since we are in a lockdown for 21 days, what is happening is a lot of mental and emotional issues are coming up because we are not really worked up to that kind of stress. So what we can do at home is read a lot of books. We can do a little bit of financial planning. We can call up our friends and family and talk to them and reduce the amount of emotional and mental stress. So what we are exactly trying to do is keeping the mind occupied and continuing the education and work even after this lockdown. So in conclusion, arthritis, knee pain, hip pain, back pain is definitely preventable. What are the requirements for it? Is that your diet should be balanced and healthy. You should maintain the ideal body weight, do daily exercises like range of motion, stretching, and this will definitely help you in maintaining your day-to-day activities, reducing your arthritic pain, reducing your knee pain. So what we need to understand at this time of our is that when we are staying at home, the most important part of our day-to-day activities is maintaining our mental and physical strength, doing your exercises regularly, and avoiding any kind of unnecessarily stressful or exertional activity, and having a proper nutrition. On this note, friends, I would also like to mention that again, please stay home, please stay healthy, eat healthy, and we will get over this major pandemic issue as early as possible, and would also like to thank all of the doctors, all of the police, all of the electricians, all of the people who are working behind the curtains in order to get rid of this major pandemic issue in the country. And also like to mention that this lockdown should be followed as per our honorable prime minister. Thanking you. I'm signing off, Dr. Kailash Patil. Thank you.